I'm Dr. Tom Umbach. I've been doing bariatric surgery for 15 years now, and I originally came into bariatric surgery when I did my fellowship at USC. I discovered then that they had these operations, gastric bypass back then, these operations that can help people lose diabetes or help cure it or resolve it, their diabetes completely without medication. And so as a general surgeon that had seen plenty of people with complications from diabetes, I was all over that. That was incredibly powerful for me. One of the things that really appealed to me about bariatric surgery is we were starting to do it laparoscopically, and even 10 years ago, really, people spent 3 to 7 days in the hospital after an open bypass. And in my fellowship, we learned to do it laparoscopic, where we can now offer somebody the same surgery and yet they could go home the same day or the very next day, because now these operations are done for little cuts instead of a big cut. I like the challenge of it. It's very personally rewarding because these operations are very tough to master and difficult to learn, and that's been a very rewarding journey for me as well. I love it when 6 months later I'm seeing people in the office and they're coming back to see me and they've lost 60, 80, maybe even 100 pounds. They're no longer taking their diabetic medications, and they've gotten rid of their sleep apnea machine, and they've gotten rid of their high blood pressure medications, and they're out there hiking or traveling or doing whatever, and they've really blossomed as people. That's what I love to see. That's one of the reasons we named our company Blossom Bariatrics. We're here because we want to help as many people as possible. Sure, I could have pricing that was 2 to 3 times what we do now, but then I'd only have 1 or 2 a month, and I really wouldn't be helping that many people. So I'm not in it to make, a quick buck or anything like that. I'm in it to help as many people as possible. So we have a very different philosophy than I think a lot of offices do. So we try to keep our costs very low. Any savings we get because of the bulk we do, or savings at the hospital, we tend to pass those on to patients. I don't think about supporting patients the same way usually doctors think about it. And one of the things we bring to that is I like to give patients my cell phone. In fact, it's on my business card, and my cell phone number is right there, so they can call me anytime with questions or concerns. We try very hard in the office to make it as convenient to patients as possible. And part of that convenience is adding in enough layers so that everything is available in the office. So for example, when patients come to their first consultation with us, they'll see not only me in consultation, but they'll also see the nutritionist because she's in our office. They'll see the insurance specialist because they're in our office. We get a full set of labs done. So we oftentimes diagnose medical problems that people didn't even know about. We do a psychological evaluation all in that first visit. And that does a couple things. One, it's easy because you just got to go to one place, you get everything done, one-stop shop. But the other thing is, we're all procrastinators, so if I give you a long list of things to do, I won't get to them because I'm busy. But if we get it all done in that first visit, we have about 90% of what we need to do done, and that's just going to make patients more successful in the long run. There's no time like now, so now is the best time to get started and get moving on this. We'd love to be in this journey with you together here at Blossom Bariatrics, so please give us a call. Give us a call today and let us help you through this process together. Or check us out on the website. We have a great website at blossombariatrics.com. Lots of good information, as well as there's people there to help you live as well with your questions. So please start today.